In this section, we'll briefly discuss the use of enzymes as drug targets, and we'll discuss this in general terms, and we'll focus in more detail on this in the subsequent lecture parts. So within this section, we're going to briefly explore how enzymes can be exploited as drug targets. So how can we control enzyme catalysis? So here we have the process that an enzyme goes through when we want to have a chemical reaction. So on the left here we have our substrate. Now our substrate will enter into the active site and it will bind, and it will cause the enzyme to have an induced fit and change its shape. What will then occur is a reaction where one product may be released, but then we have to release the rest of the product or products from the active site. Now once this product is released, the enzyme is then able to react again, so it can begin this cycle again. So what we want to do is interrupt this cycle so that we can gain control of the catalysis process. So how can we do this? Well, perhaps we could limit the substrate availability. So perhaps we could reduce the amount of substrate available to undergo the reaction. Unfortunately, this doesn't stop the enzymatic reaction. All it does is reduce the amount that is reacted. The enzyme will still produce new products at the same rate as previously, but it will do it in a lower concentration. So this isn't going to limit or allow us to control the catalysis process. How about we stop the product being released? We could introduce functional groups onto our substrate that will bind so strong the product doesn't get released, or at least the release is reduced. Now unfortunately this also doesn't let us control the catalysis process. We need to be able to turn this process on and off as the situation requires, and simply hindering the release of the product won't allow us to gain full control over this process. What we want to do is selectively switch off enzyme activity. We want to be able to switch this off completely. And so we need to look for solutions that allow us to turn enzymatic activity on and off. Now we could try binding of a control agent to the active site. So we could try putting a molecule into the active site that competes with the natural substrate. So this molecule would prevent the natural substrate from entering into the active site and prevent it from being processed. The problem with this approach is that competition with the natural substrate will eventually displace our control molecule. So in the environment that the enzyme is in, we'll have a supply of control molecule and of natural substrate. And as the concentration of natural substrate increases, it will displace the control agent from our active site. And displacing of the control agent will restart the enzymatic activity. However, what we could use is an allosteric binding site. Now this is a binding site which is not the active site. So this is a binding site elsewhere on the enzyme molecule. This is called a secondary binding site because it is a binding site that is not the active site itself. It could be somewhere close to the active site or it could be somewhere far away. But it is a binding site that we could use to control the enzyme function. Maybe we introduce a molecule into that site that changes the shape of the enzyme and stops its reaction. And this is one of the best ways that we can use to control the enzymatic reaction process. We introduce a molecule that can bind to a different site on the enzyme and affect the enzyme's ability to function. So what is an allosteric binding site and how can we use this to control enzymatic activity? Well, here we have an enzyme that is being approached by a substrate and an allosteric inhibitor. Now the substrate of course wants to enter into the active site and undergo its chemical reaction. However, the allosteric inhibitor is able to bind at another site away from the active site. And when it does this, the enzyme undergoes an induced fit process. Now this is a similar process to the induced fit that would happen if the substrate entered into the active site, but it changes the shape of the enzyme in a different way. Now when the inhibitor binds, it changes the shape of the enzyme and changes the shape of the active site. When it does this, it means that the substrate can no longer enter into the active site and react. So the allosteric inhibitor turns off the enzymatic activity. Now we can use this as a feedback control mechanism. So for example, if we have an enzyme that reacts with a substrate and produces a product, this product itself could be an allosteric inhibitor. So when the enzyme is processing the substrate normally, there's high levels of substrate and low levels of the final product. And this will result in the enzyme functioning at approximately normal levels. However, as that substrate is processed and converted into the final product itself is an allosteric inhibitor. And if that's the case, then the final product can come in and bind to the enzyme. So as more product is present and as less substrate is present, we switch off the enzymatic activity, and it switches off the enzyme until the levels of the final product have been reduced or the substrate has been increased. And so this is a feedback control mechanism. So if you imagine here we have substrate A that is processed by enzyme 1 to produce B, that is processed by enzyme 2 to produce C, etc., etc., etc. The end product of this chain could be an allosteric inhibitor that can inhibit enzyme 1. Now, if this is the case, then the production of the final product will inhibit the first enzyme in this chain, and it will switch off the reaction pathway. So we can use allosteric inhibitors as a really effective way of reducing or controlling enzymatic activity. And if the turnover of our substrate produces a compound that can act as an allosteric inhibitor, the enzyme can be almost self-regulating. As it produces that final product, that product switches off the enzyme until the amount of that final product has been reduced. And so we can use this as a feedback mechanism to switch off enzymes when too much of a final product has been produced. Now, an example of this is actually in the control of noradrenaline synthesis. Now, you do not need to remember this pathway, but you do need to remember that this is an example involving an allosteric inhibitor and understand the general concept of a product in an enzymatic process acting as a feedback mechanism. So here we have L-tyrosine, and L-tyrosine can be converted into levodopa by tyrosine hydroxylase. This places an OH group at this position, and levodopa can then be processed into dopamine by dopa decarboxylase. And that converts this group here, removes the carboxyl group here, and leaves you with an amino group. Now the dopamine can be converted into noradrenaline by dopamine beta hydroxylase, and finally this can be converted into adrenaline by N-methyltransferase. Now noradrenaline inhibits the production, or rather the action of tyrosine hydroxylase. So if we have large levels of noradrenaline, this noradrenaline will bind to an allosteric binding site on the tyrosine hydroxylase and stop it from producing more levodopa. Now, normal functioning of this pathway will only resume once the levels of noradrenaline have been decreased and the noradrenaline that is present is at too low a level to inhibit all of the tyrosine hydroxylase enzymes. So as the levels of noradrenaline decrease, binding to the allosteric site decreases and production will restart. And then it will continue producing until levels of noradrenaline build up again, at which point the tyrosine hydroxylase will then be switched off. And again, the production will be paused. Now, this type of feedback mechanism is very common in enzymatic reactions. And so it's important that you understand the concept of using enzymatic products in this type of feedback mechanism. But as I've said, you do not need to memorize this specific example. Now, enzymatic processes provide a very attractive route for drug targets. And the reason for this is if we can control an enzymatic process, we can control either reducing what comes out of that process, or we can increase that process. So we can either produce more or less of the protein that is causing the problem. And of course, by using drugs, what we're trying to do is address an imbalance or a problem in a process somewhere. So we can either target enzymatic pathways to increase production of a particular component or to decrease production. Now we can target the active site, we can also target allosteric sites, or we can target other structures. And we'll discuss this in different sections within this lecture series. Now we're going to move on to look at different types of inhibitors. So we're going to look at reversible and irreversible inhibitors, and then move on to inhibitors binding at allosteric binding sites. We're going to look at uncompetitive and non-competitive inhibitors, and then we'll finish off with transition state analogues. And these will be covered in the next few sections of this lecture series.